All right, today we're going to be doing an assessment on the musculoskeletal system. So I would first introduce myself to the patient and perform hand hygiene. So, hi, my name is Haley. I'm your nurse today. Today I'm going to be performing a musculoskeletal evaluation on you. That means I'm going to be assessing all of the joints in your body to make sure they're working properly for your age. I'm going to try to work from head to toe, but first I want to ask you if you have any history of arthritis or joint issues in your family, whether that be rheumatoid or osteoarthritis. No. All right. He said no, but if you were to say yes, I would look further into that by asking more family health history questions. So I'm going to first start off by assessing his temporomandibular joint. This is the joint right in front of the auricle of the ear. It's where the temporal and jawbone meet. So I'm just going to feel this to begin with. And if I can have you open your mouth and move your jaw side to side. Does that hurt at all?
Nope.
How about up and down? Forward and backward? Does that hurt?
Nope.
All right. Did you feel any clicking?
No, I didn't.
I didn't feel any clicking either, so that is a good sign. And then next, I plan on doing the neck. So if I could have you put your chin to your chest and look down. And I'm going to feel all of the spinous processes on his neck until I reach number 7. And you'll know when you hit 7, it's a large bump. And I'm just making sure that's all aligned. Does this hurt at all?
No, it doesn't.
Does your neck ever hurt?
Nope.
All right. Good. All right. And if I could have you look up. And can you look up for me, please? And look down. And look side to side. All right, and then I'm going to be doing some resistance exercises with him. So if I could have you look down. All right, that way. Thank you. All right, and resistance was equal on both sides, which is good. Did that hurt at all when turning your neck? All right, and then I'm going to move on to the elbows and upper extremities. So first I'm just going to feel. I'm going to feel his elbows. Does this hurt at all upon touching? Okay, I don't see any swelling or redness. And he said it doesn't hurt, which is a good sign. So I'm just going to do some passive range of motion. So if you can leave your arm flaccid for me. Let me know if this hurts at all. I don't feel any rigidity on this side. Nothing is stopping me. I don't see any facial grimacing. So I'm going to try it on this arm. Again, no rigidity, no resistance. All right, and then I'm going to have him do some active range of motion himself. So if I can have your arm at a 90-degree angle like so. Can you push up for me? Put your arm and push down. All right, and push my hands together. All right, push them outwards. All right. Have your arm. And can you put your arm to your body? There we go. I'm gonna do it on this side. Abduct it, so bring it away from the body. Can you do it again? Did that hurt at all?
Nope.
All right, good. So next, I'm going to move on to his wrists and hands. So carpal tunnel is a really big deal. So we want to make sure that we are feeling, asking constantly, if it hurts at all while we're palpating. And feel all of the tiny bones in the hand to make sure there's no masses, bumps, unusual calcifications, because that can happen. You want to do that. You want to feel all the fingers. Notice if there's any abnormal nail color or shape. So we're feeling everything looks fine. Do the same on this hand. And then I'm going to be performing something called Tennille's sign. So this test for carpal tunnel. Carpal tunnel attacks the median nerve in the wrist. So I'm going to be asking him questions while I'm doing this. Do you work at a computer at all?
Yeah, I do.
How many hours a day?
Around 10.
Do you sit down or stand up while you're doing that?
Stand up.
Stand up? Okay. That is a good sign because posture can really affect this as well, but we still want to make sure that he's using user-friendly keyboards that wouldn't progress carpal tunnel any further. But with the Tennille's sign, we are going to tap the median nerve just slightly. And do you feel any shooting pain to your fingertips at all?
No, I don't.
No? All right, so that means he was negative for the Tennille's sign, but if he were to say yes, we would move on to the Fallon's test, and that is something else we use, a further test for carpal tunnel. So if I can have you act like you're praying and move it downwards. I would have him stay like that for a minute, and I would assess if there's any color change, any facial grimacing, and he would let me know if there's any tingling or anything, numbness after that 1 minute. Then we would take further action for carpal tunnel. All right, and you're good. And then next, I'm going to be skipping around a little bit. This is just to, if someone was to have any arthritis issues, we want to make sure we want to keep them comfortable. We don't want them going up and down and up and down. Of course, exercise is good to have, but someone who has arthritis issues doesn't want to move as much. So I'm going to, while he's sitting down, assess his knees. Athletes tend to have bad knees as they get older. Does this hurt at all?
No.
How about this one?
No.
No? Okay. And then I'm going to do some resistance exercises. So if I can have you press up against so bring your legs in, legs out, legs in, legs out. All right, I'm going to do the same on this. So leg in, leg up, leg in, leg in. All right, and he was equal upon resistance on both sides. Did that hurt at all, doing any of that?
Mm-hmm.
That's testing both the knee and the hips. So I'm not fully done, but I'm done with the sitting portion. So I'm gonna ask him to lay down. Can you lay down on your back for me, please? I'm going to be doing some more hip tests. So if I could just ask you to touch your knee to your chest, or try to. And can you move your leg outwards and inwards, crossing the other leg? There we go. And if I could have you put your leg down and do the same on the other side. And bring it out and bring it crossing the over leg. Oh, there you go. All right, and you can put it down. Did any of that hurt? Any discomfort? Okay, that's a good sign. All right, and then next I'm going to assess the ankles and feet. Again, there's a lot of tiny bones in the feet, so we want to make sure that everything's okay down there. Does this hurt at all?
No.
Again, I want to see some active range of motion, so if I could have you move your foot in a circle for me, please. Same with this one. All right, and then I'm going to do some resistance exercises. So if I can have you put your leg down, push against mine. All right, and push up. All right, and push out. And push in. And do the same with this one. So push out. Push down. Push in. And push out. Okay. Everything was equal and strict again as he's lying down. That tests more of the hips. All right, and that's all for the sitting portion. So now if I could have you stand up. All right, back up for me. And this is going to be some more, we're going to test the arms and legs here, balance. So if I could have you lift your arms up and around your head. Let me know if you feel any discomfort.
No, we're good.
All right, and then down, behind your back. Any discomfort?
No.
Okay, and then we're going to pretend like we're lifting a box straight. And down. I don't see any resistance, facial grimacing. He's letting me know that he's not in pain. All right, so our upper extremities are pretty good. So then we're going to move down to our lower. We're going to do some balancing. Of course, I would assess how he walks around the room. We don't really have the space to be doing that here, but I would have him walk around the room, making sure there's no limping. If he were to be limping, there may be some joint degeneration going on there, some arthritis. So if I could have you stand on one foot, balance for me, bring it up and back, and then point out as you're coming forward. Do you feel any discomfort on either of your legs?
Nope.
All right, and we're going to try it on the other. Forward, backwards, forward, straight out, backwards. How about, can we do a side? You could try to with the space constraint. Okay. Any pressure on either?
Mm-hmm.
All good? All right, so you're telling me that all of your joints feel okay during this assessment?
Yep.
All right, good to know. And that is it for our musculoskeletal assessment today.